Hello, good evening, everyone. My name is Timotheus Dorh, and I am the chair of the North America Caribbean region for the International Diabetes Federation. I was asked by Roslyn to make this presentation to our general membership and people living with diabetes, and I think it's fair. It's a good initiative, and I hope this information helps out. I must declare, though, that I'm not a researcher, but I am one of the people on the receiving end of information, just like many of you. And this is information I've found from a few sources that I believe are reliable sources of information. I will share those sources at the end of the presentation. So I've named this presentation COVID-19 and Diabetes. And in the presentation, what I want to accomplish is to speak about what is the coronavirus, why does it affect people living with diabetes, how should you prepare, and what should you do if you fall ill. So the coronavirus, we know, is new, and that's because it only began a few months ago. I think it was December when we had the first recordings of anybody being infected. And because it's so new, there are many things that we don't know about it. What we do know is that as of today, there are about 571,000 people thereabout who have been infected, and approximately 26,000 people who have succumbed to the infection. That means that roughly 4 to 5% of the population who have been infected would have eventually died from it. And based on the statistics, we find that the majority of the people who have fallen ill and have had severe illness fall into the category of people who have some immunocompromised state, people who have diabetes, high blood pressure, some cardiovascular disease, and people of the elderly category. So it is a potentially serious infection. We don't know a lot about it, but the information we have currently is what we can use to guide our actions. The WHO has declared the COVID-19 infection public health emergency of international concern. We know that it is spread through air droplets when people cough or when people breathe. We also know that it causes flu-like symptoms. So that would be something a lot of people are aware of. And the flu-like symptoms would include a runny nose, sore throat, coughing, sneezing, some malaise, maybe some muscle pain, some fever, which is a common symptom. And people generally would be ill within a few days of being in contact with someone who has been ill. And we generally expect the illness to last just about a week, but it could go up to 14 days. And it also takes up to about 14 days for someone to fall ill after being in contact with somebody else. So just to give you a bit of information, this is what we know. There's a lot more information, but these are the bits that I feel are most important for this presentation. So why does COVID affect people with diabetes? There are mainly two reasons. The first is the immune system is compromised, and that is generally in people who are struggling to control the diabetes. You have the immune system being compromised in that your body is unable to respond as it would or as it should if it were in a normal state. You have elevated blood glucose levels, which also affect your ability to be able to fight. It also is a condition under which the virus would thrive. So you have your body being unable to defend you, and that's the immune system being compromised. And then you have the elevated blood sugar, which is a condition under which the virus thrives. It starts to multiply and it grows very well. So that's why people with diabetes would be more at risk for having a more severe illness. So what's important is preparation. Preparation, I think, is going to really help people to tide the storm when it does arrive, if it does arrive, right? So storing relevant contact details just in case you need it. And I mean contacts of People who are aware that you are living with diabetes, contacts of maybe a driver if you are not driving, your mechanic if you're driving and you also need to get your vehicle fixed, contact details of your pharmacy, of your physician, your hospital, contact details of people who can assist you in any case of an emergency. So you need to have these numbers handy and somewhere where you could reach it easily. Pay extra attention to the glucose control. And I say this, and it's absolutely important that you make sure you test and be aware of how your blood glucose responds over the days as you're eating, as you're going through your regular activity. Don't take any chances if you fall ill. I know in our culture, a lot of people tend to try to wait when they start to fall ill to see if their body will recover. If you start to feel ill, you need to act aggressively. And acting aggressively doesn't mean you need to call the ambulance. It means that if you start to have a sore throat, take some medication for it. If you start to have a fever, take some medication for it. Drink lots of fluids. Try your best to combat those symptoms as soon as they arise so you give your body a better fighting chance. Don't wait and allow things to get worse. Make sure you eat, make sure you do all of those other things that are important in order to help yourself. And a lot of us have been through flu-like symptoms before, or the common cold, and we know what we have done in the past, which has helped. So we need to continue those things to try to prevent things from getting worse. Make sure you have sufficient access to water supply. It is important to avoid dehydration. So if you have sufficient water, it's going to place you in a very good position to fight. Make sure that you have a good supply of diabetes medication. We have been asking people to make sure you have at least a month or a little extra storage of medication, just in case you're unable to go out to the pharmacy. In fact, we advise people to avoid going out as much as possible. So if you have extra medication, that will prevent the need for having to go out to the pharmacy just to get medication when you have all of it stored. Make sure you have enough access to good food. As far as I know, there's not been a shortage in the food supply chain to many of the countries. So as much as travel restrictions have occurred, you don't have the food shortages as yet. So for now, people should try to stock up on those foods that they would need just in case they are unable to go out, and to also avoid them from having to go out too often. Have some sweet beverages handy just in case there is a sugar drop. At some pharmacies, you may be able to get the glucose tablets. That'll be really good. If you can't get those, then just have some sweet beverages in your house somewhere so that you can use that just in case you have a sugar drop and you need to act quickly. A personal emergency plan is something that I've advised every single one of my patients. And that means that you are planning ahead for just in case there is an emergency. If you start to feel ill and you need to get to the hospital. So having that emergency plan involves you having an escape route, having your phone numbers stored on a phone somewhere close to your door or close to you so that you can access it when needed. Also having the numbers for your emergency room, for your buddy, if you have a buddy system, having those numbers on speed dial so that you could call them just in case there is an emergency. We also advise that people keep a regular schedule. Avoid overwork as much as possible. There's no need to stress out at this point. Really, most of the countries on lockdown and shutdown, so take advantage and try to relax a little bit and try to get a good night's sleep. It is possible. Maintain a healthy nutrition, and that would involve eating sufficient vegetables and fruits, eating the right kind of proteins, avoiding the fried foods as much as possible. These things are quite important. And exercise. I can't emphasize the importance of those last two enough. Eating sufficiently and exercising are paramount to being able to place yourself in a good position to combat any issues relating to complications of diabetes. So when we talk about prevention, these are the things that you'd have seen on the TV, or you'd have heard on the radio, and you've probably seen on handouts, or you've seen on posters all over medical places all over your town or your city. So wash your hands thoroughly and regularly. Many people are instituting a system where they wash their hands every hour or every half an hour. You need to wash your hands regularly to try to get rid of the virus, because we do know that washing your hands kills the virus. So if you can kill the virus by washing your hands, why not? You could also use alcohol-based hand sanitizer that you apply on your hands, allow it to dry. Make sure you ensure that you apply it to every single area in the hands. Avoid touching your face. I know this is difficult, but there are many different ways that people have tried to encourage people to avoid touching their face. It is a natural thing to touch your face. However, if you avoid touching your face, if you avoid touching your face before you've washed your hands or dried your hands, if you avoid touching your face once you've washed or dried your hands, then that'll really help. Clean and disinfect any objects and surfaces that touch regularly or frequently. Don't share any food, any glasses or towels, or any tools that you have with other people. It's best to cover your cough or sneeze, or cover your mouth or nose. You need to cover your cough or sneeze with a tissue and immediately dispose of that and wash your hands, or you cover your cough or sneeze using the crook of your arm, your elbow. Try to avoid contact with anyone who's showing symptoms of respiratory illness. You won't be avoiding this fever forever, but at this point we need to try to avoid illness, so that avoid being in contact with people who are ill, so that we don't get ill ourselves. Avoid any unnecessary travel. Many of us feel that it's important to go make that trip to the countryside, or make that trip to our friends at this point, because we bored, or we tired, or we don't want to go, we don't want to stay in one place. However, it is important to avoid the necessary travel, so that you avoid any contact. And it's not forever, it's only for a short space of time. So we want people to avoid the travel as much as possible. And if you are ill, if you have flu-like symptoms, then it's best to just stay home. Stay home. You won't lose anything by staying home. And our governments have already tried to accommodate that for everyone. So stay home if you feel ill. If you do become ill, right? Now, the first thing I need to tell you is do not panic. Do not panic, because that's not going to make things any better. Also, do not panic because you are well prepared. You know what you need to do. All you need to do is do it. Now, continue taking your diabetes medication as usual. Test your blood glucose every 4 hours, and try to make sure you keep track of the results. This is also important for people who are on insulin. Test your blood glucose as often as possible, so that you are keeping track of where you are. You need to avoid dehydration, and that you would do by drinking plenty of fluids, whilst you try to eat as normal as possible. It is also good to weigh yourself every day, because weight loss whilst you are eating properly could be a sign that your blood glucose is a bit elevated. So you need to also keep track of that. Checking your temperature every morning and evening is also a good way to make sure, or to check to see if you're getting worse, or if you're still ill. So you could check your temperature in the morning and in the evening. You may not really feel hot, but then that would give you an idea of whether or not you're ill, and whether or not you need to escalate. So there are many other bits of information that's out there. There's information you can get from the WHO website, of course. You can get lots of information. Most of what I receive, what I've spoken about, is from the International Diabetes Federation website. So you can get information from there. That's the website right there, the last one. Many other associations around the world have published articles. And if you go on the IDF website, you will also get links to those other pages. So you get information that, of course, they particular to the country, but sometimes it does apply. to us. So you can use that information to help guide you. The take-home points, if you don't remember anything, is prevention is way better than cure. So try to avoid getting ill if you can. If you do fall ill, it's not the end of the world. Just try your best to keep well hydrated and go ahead and take your medication as often as possible. There are some reasons that you probably need to call up or call your doctor or go to the emergency room if you do fall ill. And that would be if you're just totally unsure, you're scared and you're not sure what to do. I wouldn't advise you to just sit home and wait. Just go to the hospital or call your physician so you can get something done for you. It's better to be safe than sorry. If you find that the blood sugar is elevated for well over 24 hours and it's not going down despite your efforts taking medication and also trying to control the fever or whatever the symptoms you have, it is probably best you reach out to your physician so you can get some assistance. If you find that you are unable to keep down any medication, so that would involve vomiting, then that would be a good reason to go because you stand a risk of dehydration and it could cause some complications for you. If you notice that there's signs of ketoacidosis, then these are reasons for you to really go ahead and get some help right away. Because these are signs that things could get really bad really fast, and that's what we want to avoid. It's the complications that cause the problems at the end of the day. So if we can avoid those complications, I think we will be in a better position. I hope this is helpful, and thank you very much for listening.
Okay, soldiers. COVID, please leave us alone.
COVID, please leave us alone.
All of us are staying home.
All of us are staying home.
I know you want to see us dead.
I know you want to see us dead.
You're staying home so you won't spread.
You're staying home so you won't spread.